It is the CEO of Vivos Therapeutics. It's ticker VVOS, Kirk Huntsman. Kirk, are you out there?
I'm
There
here.
he is. Woo! I knew you were out there.
Yeah.
How you doing?
I'm doing great. Good to see you.
Yeah, very good to see you. I like the where are you right now? I like the background.
Yeah, I'm at our International Training Institute in Denver, Colorado.
Amazing. Awesome. Well, it is just afternoon there for you, I guess, in Mountain Time. So
That's right.
have a nice afternoon, and I'll see you in like 20 minutes when you're done. We'll ask a couple questions.
That's great. Well, hey, thank you so much. We love Benzinga and have had great experiences here in the past. So welcome everybody. We appreciate the opportunity to present and give you a little bit of an update and orientation to Vivos Therapeutics. We are a medical technology company that addresses the market for obstructive sleep apnea. For those of you who don't know, my name is Kirk Huntsman. I'm the co-founder and CEO. I have with me today Brad Ammon, who's my chief financial officer. He's actually behind the scenes here working the slide deck. So we're both here today. Let's talk about Vivos. There are over 1 billion people worldwide with this condition called obstructive sleep apnea. 80 to 90% of them, and it's closer to 90% when you go global on this, but it's closer to 90% of those patients that have sleep apnea don't know they have it. And yet sleep apnea is comorbid with close to 50 different what are called comorbidities. That means these are things that are found that patients suffer with right alongside their sleep apnea, that sleep apnea either makes worse or contributes to in some way or even causes. So we're talking about all the major chronic ailments of mankind. We're talking about cardiovascular, we're talking about diabetes, we're talking about hypertension, cancer, fibromyalgia, ADD, ADHD, bedwetting in children. We have all kinds of things that happen with obstructive sleep apnea. The question is, why? Why are so many people in 2021, why are so many people still walking around with this disease, and why are so few receiving treatment? We believe there are two main barriers to this, two main answers to this question, and this is important to understand if you're going to understand Vivos. The first is that doctors really don't know who has it. People don't go to the doctor and say, hey, my sleep apnea is acting up. Most people don't know they have it. The second issue is that modern medicine hasn't been able to fix it. Treatment options are often unappealing, they're costly, they're ineffective. Nobody wants to go into surgery. Nobody wants to have something implanted in their chest or in their throat. Nobody wants to have a CPAP machine for the rest of their life. So modern medicine hasn't really had a great option. So along comes Vivos, and we have two breakthrough technologies, one that we have the exclusive license in North America for, and one that we have that's our own proprietary IP that we own for our therapeutic side. So we have two breakthrough technologies. We'll discuss each one of those. In the upper right-hand corner, you see our Vivos Score devices. In the lower left-hand corner, you see our therapeutic oral appliances. Both of these are unmatched and unparalleled in what they do and why they do it. So let's just go through the next slide, Brad. There we go. Let's go to the next one after this. All right, so let's talk Vivos Score. Vivos Score is a technology that was originally developed at Harvard University, the Beth Israel Deaconess Medical Center there at Harvard. It was developed by Dr. Robert Thomas and his team, and it's called cardiopulmonary coupling. This is the one sensor, single sensor replacement in many respects for a full-on polysomnogram. This is the polysomnograms are or PSGs as they're called, is the in-lab overnight sleep test that people have had to use over the years. We've taken this technology is 98.9% correlated to a polysomnogram in terms of its output and its diagnostic accuracy. 98.9% is accurate. A single sensor that fits on your finger, your thumb, it plugs into Bluetooth connects to your cell phone, and then from there monitors your sleep overnight, reports generated the next day, FDA cleared all around the world actually, but FDA cleared here in the United States and Canada, and it lowers the cost by from between $2,000 and $3,000 for a PSG, a polysomnogram, down to $3, as low as $3 for a test overnight. I mean, it's incredibly cost effective and efficient. It allows us to solve that first problem that I talked about, which is doctors don't know who has it. Now they have a ring that they can show or that they can distribute to their patients very cost effectively, very quickly, very easily. For the form factor for patients is so easy to use. So we have been using this now for several months. We're seeing dramatic rises in the number of people that we're testing, that our doctors are testing, and the number of cases that are being started as a result of those tests. Very encouraging, very strong for us. Then once they are tested and they know they have this, then we put them into the therapy of the Vivos system, what we call the Vivos system. This, you're looking at our latest FDA cleared, we announced a few weeks ago, the clearance on this device. This is our mmRNA. This is we have 510K clearance on this device. This, I know it looks a little bit like a beast to put in your mouth. It actually is extremely comfortable. There's no pain associated with this. There's no discomfort. You wear this in the evening hours and overnight, and you wear it for a period of time. And what begins to happen is your AHI scores will lower. AHI is apnea hypopnea index. That's the score by which, the metric by which medical doctors determine the severity of obstructive sleep apnea. It's not the only way to diagnose sleep apnea, but it's the primary sort of go-to standard. If you'll go to the next slide. So this is on a scale of how many apnea events per hour. So if you have less than 5, you're within normal limits. If you have 5 to 15, it's mild. 15 to 30 is moderate, and over 30 is severe. Our clearances are for mild to moderate, but we actually, our doctors off-label, they treat all manner of different sleep apneas. So the goal is always for treatment to drive that number down. You want to lower these sleep apnea events, and if possible, you want to get them back to within normal limits. The only way to do that is with our appliances. Otherwise, all you're doing is intervening with something like CPAP or surgery or whatever. You're intervening to try to create some type of a temporary palliative type solution, whereas ours is in and out of treatment within a defined period of time, usually 12 to 24 months. You're in and out of treatment, and at the end, you've got a big, bold new airway. Let's show them what it looks like. So this is a patient, a 30-year-old male in this case, but very typical of the kind of results we get. 14 months in treatment. The image on your left and on your right is this exact same individual, 14 months apart, pre-treatment and post-treatment. And what you see on the left is the colorized version is the airway of this individual, which was tight and constricted, and he had severe sleep apnea. Then you go to the right-hand side and you see this 30-year-old male's brand new airway, and his treatment stopped. You'll see that it's twice the volume. He went from 13.2 cubic centimeters to 26.5, I believe. And you'll see that his airway size has grown dramatically. Remember, the airway is not an organ of the body, it's a functional space. The size and shape of that space is determined by the positioning of the tissues around it. So what we do at Vivos is we use our appliances to reposition the tissues in a stable way so that they never regress. So or at least that's the hope, right? So this patient here has an airway which has doubled in size, and his treatment completed actually in 2018. It's now 2021. He's walking around with that same airway, has not had any intervention since, and his airway has remained pretty much the same. And so what we see is, in case after case, patients coming in for treatment, experiencing the treatment, covered by insurance in the vast majority of cases, and coming out of the back end of treatment a year and a half later or thereabouts, and they've got a brand new airway, and they go on the rest of their life with that. So here's a 73-year-old male, 17 months in treatment. You can kind of see the same thing. What we did in this case is we pulled the airways out of the image so you could see it a little better. You could see he also more than doubled in volume. But Brad, if you go to the next slide, we're going to show everybody. So this is this man's airway. You can see the airway from a side view and then a frontal view, and then before treatment and after treatment. You see that his airway doubled in volume. When we increase the size and alter the shape and improve the patency of the tissues, we actually end up with an airway that is less prone to collapse. And so the AHI scores just go down and down and down. And that's what we're trying to do. We're trying to get the patient to sleep through the night with deep sleep and no apnea events, or as few apnea events as possible. We've treated over 19,000 patients. We have 17 published studies. All of these show a significant reduction in AHI scores. The mean is about 67%. Very comparable to what you might see, by the way, at Inspire Medical or with CPAP or these others. The key thing for us, if you look on this competitive landscape chart, the key thing for us here, guys, is that our technology, the patients are in and out of treatment. There's not a lifetime intervention. There's no surgical implant. There's no altering of your face surgically. This is an in and out of treatment type non-surgical technique covered by insurance, very cost effective, very efficient for the patients, no pain, no downside type indications here. So it's very, very, and as far as we know, the effects seem to be lasting for years and years and maybe a lifetime. We've gone back out to about 8 years right now. We don't see any changes. After we affect the treatment, we alter the landscape for the airway and the oral cavity, and we get these results, and it seems to be a lasting result. So that's where we're at with this. Let's keep going, Brad. Let's talk about so how this works. So our revenue model. We actually have two different buckets in our revenue model, our revenue stream. One is the services bucket, and that's where we train doctors. They pay us about $30,000 a piece as they come on board and enroll. They pay us an average of about $30,000. And then they start doing cases. As they start doing cases, we pick up the recurring revenue stream. So as they do 1, 2, 3, 5, 10, 15 cases each month, they get to the point where they're paying us, roughly $1,500 to $2,000 per case. Each of these appliances that you saw is customized for the individual patient. So there's a different pricing model for each, depending on the degree of customization and the configuration of the device. So the recurring revenue stream comes out that way. We also have pediatric, what we call Vivos guides that are also for the kids' cases. There's lots of kids with these conditions out there. And so we have about mid-70s margins on the appliances. We have mid-80s margins on the services revenues, and it works out to a little under 80% for overall gross margins. So we have good gross margins. The business for the dental community is absolutely spectacular. They'll be collaborating with the physicians on this, but they'll be driving the actual appliance and the case itself. The physicians have a role to play, an important role to play diagnostically and also supervision-wise, but they don't really keep the bulk of the economics. The bulk of the economics rests with the dentist that's doing the heavy lifting with the appliances. And for that dentist, they're going to charge the patient between $8,000 and $10,000. Again, most of this covered by insurance. And then with their total overhead deductions, they've got about $3,000, including our fees. And then they end up with a take-home paycheck for a couple hours of work of about $6,000. Every dental office in America has hundreds and hundreds and hundreds, maybe even thousands of patients that already exist in that practice, coming through hygiene every week of every month, and they have sleep apnea. With our Vivos Score device, the hygienists now have a very easy opportunity to enter into a dialogue with their patients about their sleep, give them a device to go home and test to establish a baseline. The patient comes back, the medical doctors are involved if there's a sleep apnea present. We get about 50% of the patients that get tested with our Vivos Score devices have sleep apnea. And then it becomes an issue of what type of treatment, what do they want? Do they want to have a CPAP for the rest of their life? Do they want to go into Vivos? Is it a combination therapy for a while? What exactly do they do? So that's how that works. Great economics for the doctors. We've talked about the insurance. Again, about half, almost all insurance carriers in the U.S. will pay for this. And so we have, well over 250 million lives covered here. And we just have, it just depends on each patient with their individual policy and their individual coverage amounts as to how much of each case is covered. But for the most part, it's all covered. And so here we go. So this is the ecosystem, what we call the ecosystem. If you dig into the sleep apnea market, you're going to learn very quickly that sleep apnea is a condition where the service model for rendering health care services to sleep apnea patients is broken. It's severely broken. It's broken beyond repair. There's too many different ways in which sleep apnea patients fall through the cracks. So we've created an ecosystem centered around the dental office of all places, but it's centered around the dental office. And we provide to the dentists in the dental community. There's over 200,000 dentists in North America. We supply them with all the turnkey products that you see on the screen that give them access to services, support, billing features, training features, diagnostic features, referral from medical community members, other adjunctive therapy services. All these things you see on the page here are ways in which Vivos as a company supports the 1,400 or so providers in North America that we have. There's a Vivos provider in virtually every major market, every major metropolitan area in the United States, and all across both Canada and the United States. So we are well covered in North America. You don't have to drive very far in virtually any major city to get access to a Vivos trained provider and to enter into the ecosystem. So, our competitive strengths, nobody has a technology like we have. Nobody has a diagnostic tool like we have. Nobody has the clearances. Nobody has the leadership position as a first mover in this space. And eventually we will be the go-to supplier for sleep apnea, the go-to therapeutic and diagnostic provider for sleep apnea throughout the world. That's who we are. That's what we have. It's technology that's actually that disruptive and that good. This is our last 2 years of, mostly 2 years of financials. And I'll let Brad talk about this for just a moment and give you a brief synopsis, and then we'll wrap up with any questions you might have. Brad, are you there?
There we go.
We got you, Brad.
We can see you now. We can
see me? Okay.
Yep. Go ahead.
In the middle two columns, you can see 2019 and 2020 full year results. Vivos revenue increased from $3.8 million in 2018 to $11.4 million. We tripled in 2019. And then in 2020, full year revenue was $13.1 million, which is a 15% year over year increase. In the right two columns, you can see the 6 months ended June 30th, 2020 and 2021. Total revenue for the 6 months ended June 30th, 2021 increased 23%, from $6.5 million to approximately $7.9 million period over period. And second quarter revenue increased 37% from $3.3 million for the 3 months ended June 30th, 2020 to $4.5 million for the 3 months ended June 30th of 2021. And that increase was really due to our appliance product sales increases, as well as increases in our billing intelligence service subscription revenue. As Kirk mentioned earlier, margins are in the 79% range combined for product and service revenue. And our cash balance as of June 30th was $34 million. And we have just under 23 million shares outstanding.
Thank you, Brad. Okay, so that's pretty much Vivos. We have assembled here what we think is a world-class management team and leadership team here at Vivos. Dr. Singh actually just accepted an appointment to Stanford University as an adjunct professor. He's going to be on sabbatical for the next year out there. But it speaks to, they wanted him to come out to not only teach, but to also conduct some research and be a part of their faculty. We have a tremendous team, tremendous technology, a first mover advantage in the marketplace, positioned really well to take this market by storm. And we just announced a medical consortium of some high profile doctors that are joining us and across the world. We have a tremendous board of directors. I mean, we're set up for total success. So I'll take some questions. I don't know if you guys have any, but if there's any way to take questions, we can do that, or we can just wrap up.
It's always nice to hear from you guys. Kirk, you're very well-spoken guy. It's always nice to listen to you and get a little bit of the insight that you're providing. I got a couple quick questions, if you don't mind. Sure. Yeah. Okay, so I know you guys are targeting the mild to moderate sleep apnea market. How much larger or smaller is that segment of the market versus the severe side of things?
We don't really differentiate, honestly, Brent. Okay. Our doctors are the guys that do that. There's not any... The mild, moderate, severe is a construct that's done by mankind. There's not anything in the degree of complexity in the case between mild, moderate, and severe. Some cases are can be mild and be very complex. Some cases can
Sure.
be severe and be very complex. So we don't try to make that call. We put our product out there with our indications of use that the FDA has granted us. The doctors will use it as they see fit in their practices, but they'll treat the full spectrum,
Gotcha. Awesome. And we had a question from the audience, but you answered it, but I will go sort of one step. The question was about insurers that are recognizing the Viva system. Any plans that your team is able to push forward as far as, I think you said about half of the insurers are covering the device right now. Is there any plans to try to expand that or all, or is that not something that you're seriously concerned with?
Let me address that very quickly, because I think I might have misspoke or you might have misunderstood.
Sure.
Almost every insurance carrier in the United States will cover this product. Okay. So there's only a couple. There's the Blue Cross Blue Shield of Michigan. There's one other one somewhere, I don't even know, that call this investigational. They have it categorized so they don't really reimburse on it. Everybody else covers it. Aetna, Humana, the other blues throughout the country, Anthem.
Great.
All of them. Okay. Now, the issue though is that a patient, so let's just say a patient has a $10,000 treatment plan. The patient may only get, after deductibles and whatever, they may only get $5,000 covered. So they're going to come out of pocket for some of it, depending on their deductible, their policy, and what their insurance carrier says. But there's coverage available for almost anybody who wants it. Interestingly enough, about half of the patients that go through this never bother with their insurance. They just pay out of pocket.
Cool. Okay. I'm glad I asked you that question then. Well, thanks for joining us, gentlemen. We have Kirk Huntsman and Brad from Vivos Therapeutics. It's ticker VVOS. I hope you gentlemen have a great rest of your day.
Great. Thank you, guys. Appreciate it.
Thank you, Brad.